If I had post-concussion symptoms for even 4 weeks, I would be getting worried. Even knowing a bit about post-concussion, I would be concerned. I'm not
Yeah.
back at work. This should have been finished within a week or two, maybe 3 weeks. Go to the GP. Oh, well, you'll be fine, but I'm not. So I would be getting concerned. So there would be a degree of anxiety.
Hi, everyone. Welcome back to Wired for Hope. I'm Dr. Jess, a clinical psychologist, university lecturer, and published author. On Wired for Hope, we talk about all things brain injury, cognition, and mental health. If you like this episode, you can like and subscribe, and you can also follow me on Instagram at Dr. Jess Neuropsych or at Wired for Hope podcast. Without further ado, please enjoy the episode today. I did think today I was going to bring just my handwritten notes because I thought you would appreciate that,
I would like that.
given the technophobia.
And have you done that?
I have indeed
Wow.
in this
Oh, okay.
I Love
Nice.
Spreadsheets
Okay.
book.
Oh, right.
Okay,
Yeah.
so thank you, Nigel, for coming to
You're
Barn.
welcome.
We have your array of books here. Actually, let me just read this before we start. This is the one you signed.
Oh, right. Yes.
Yeah.
Yeah.
Overcoming Mild Traumatic Brain Injury. Very long title. And Post-Concussion Symptoms, a self-help guide using evidence-based techniques.
That's the one. Yes.
And do you remember what you wrote?
I often, if I write it, say it's a bit of a page turner. Did I say that in that one? No, something different. I
You
usually say
just-
this is a great page turner.
Yeah.
Is that what I put in there?
Something like that. Jess, you will absolutely love
Right.
reading and rereading this brilliant little book,
Oh, right.
Nigel.
Yeah, that sounds about right. And I'm sure you did.
So we've got all your books today,
Good.
and you're an expert on mild head injury.
Mhm.
So I was wondering if you could start by telling us a little bit about what a mild head injury is.
Yeah, so as you may know, head injuries are very, very vast in terms of what they can look like. So at the one end of the spectrum, there is a mild head injury, and then at the other spectrum, you can have a very, very, very severe head injury to the extent that you can be killed by it, or you may end up very, very disabled, not being able to live independently. That's at the severe end of the spectrum. So mild head injury is, as it implies, at the end of the spectrum that is better for you if you can have a head injury. And generally speaking, most people would say a mild head injury is one where you have a blow to the head. There is some disruption in consciousness. So you may be a bit confused, at least immediately afterwards. You may actually lose consciousness for maybe a few seconds or even a few minutes. Or you may have a period of time around where you got hit, where you have little or no memory for the events afterwards. That's called post-traumatic amnesia. So if those things are short periods, so you have post-traumatic amnesia of maybe just a few hours, you're not knocked out, but you just kind of are a bit dazed, or you are knocked out, but for a very, very short period of time, you're probably going to be defined as having had a mild head injury or a concussion or a mild traumatic brain injury. They're kind of used fairly synonymously. Yeah.
And one of the things that you were telling me about, which I thought was really interesting when we were speaking, sort of putting the podcast together, is you were talking about how the world of mild head injury can feel in some ways a little bit more complex because of the psychological factors that are sort of foregrounded, I think, for this
Yeah.
particular population.
Yeah.
And I was just wondering if you could expand on that a little bit and talk about what those factors
Mhm.
are that makes a mild head injury a little bit complex in
Yeah.
that
Yeah.
way.
Well, what I'll give you an example of the only mild head injury I've ever actually witnessed as it happened. Involved my brother playing football some time ago, football or soccer for your North American viewers. And then I'll kind of lead on from that to kind of think about what some of the psychological factors might and might not be, kind of thing. So this was probably 15, maybe even longer ago. We're playing football. I'm the captain of the team playing football. And it's about halfway through the first half. I think it's 1-1. I think I'm playing very well. My brother is playing all right. And I remember very, very vividly, he went up for this header. This other guy went up for the header from the opposition, both fully committed to the ball. And there was this sickening crunch of heads. You could hear it almost resonate around the football pitch. So everybody, oh my goodness. So we all run over, and the opposition guy is screaming a little bit, and he's clearly very, very hurt in his head. So all the attention is on him. My brother has kind of got up at this point, and we take the opposition guy off, and we carry on playing, and we get to half time, and I'm giving my rousing halftime speech, rallying the troops. You know, we've got to do a bit better. It's 1-1, but we really need the second half. And as I'm looking around all my players, my brother is looking at me with this kind of very glazed look in his eye and a kind of inane smile. And I'm thinking, I'm not really saying anything that's very funny. So anyway, I suddenly, I've been in mild head injury all my life. Up to that, I suddenly have this kind of light bulb moment. Oh my goodness, I wonder if he's in post-traumatic amnesia, this period of confusion. So anyway, I take him to one side and I start to ask him some orientation questions about, do you know where you are? And he looks around with this inane smile and says, oh, I'm playing football. I said, you know where it is? He said, oh, no, I don't. I said, you know what the score is? He says, no. And I said, well, if I told you the score was 5-0, would that sound about right? He said, oh, might do. Anyway, it was quite clear he was disorientated in time and space. He was in post-traumatic amnesia. He was still fully conscious, still playing football. Pretty well for him, I would have said. But anyway, so we had to take him off to accident emergency, which was nearby. I carried on playing the second half, and when I got to accident emergency, about an hour and a half later, he was out of PTA. So out of
Okay.
post-traumatic amnesia, he was fully conscious. He knew that he knew that he had a head injury. Couldn't remember much about the match, so he
Mm-hmm.
had amnesia for the match. But he was fully conscious. They checked his eyes, and they were equal and reactive to light, which is one of the signs that you're probably doing okay.
Mm-hmm.
Um, and they'd done all their checks at A&E, and that was the end of his mild head injury. Apart from he was still feeling tired, and possibly his concentration might not have been quite as sharp.
Okay.
So he went home. I reckon he had 2 or 3 days where his fatigue was not ideal, but it was okay. Concentration maybe not quite as sharp as it would have been before his mild head injury, but by the time Monday came around, he was well enough to go back to work as a teacher.
Okay.
And so for him, it was a fairly typical mild head injury where you have possibly have some post-concussion symptoms like fatigue, poor concentration, short-term memory, dizziness, those kinds of things. There's a whole range of symptoms that are called post-concussion symptoms, but they resolve over a few days, maybe a week or 2 or 3, something like that. That's a fairly typical
Mm.
mild head injury. And so for my brother, it was just that. However, there's a small group of people
Mm.
where it's not typical and where actually those symptoms go on for weeks, sometimes months, and for a very small minority for years, and they appear permanent in nature. And it's that group of people where those symptoms are more persistent, where over time other factors can start to contribute to the symptom picture, because these
Mm.
symptoms, post-concussion symptoms, they're not very specific. They're not just about a mild head injury. You can have all of those kinds of symptoms if you're very anxious, if you've got post-traumatic stress disorder, if you've
Mm-hmm.
got pain. All kinds of things can cause you to have similar symptoms to post-concussion symptoms. So over time, those other factors can build up and cause the same kind of symptoms, or be exacerbating the symptoms that are still due to this subtle brain injury.
Mm-hmm.
And therein lies the big conundrum when people have a more complicated mild head injury or more complicated concussion, where they're just not getting better as
Mm-hmm.
most people do.
Mm-hmm.
And that can last for months, sometimes years.
Mm-hmm. Mm-hmm. And in all of these books that you brought today, you talk about CBT
Mhm.
for mild head injury,
Mm.
and kind of some of those yeah skills that people can start to learn around
Mm.
managing those symptoms. Is there anything that you might be able to say on that?
Well, I think the first thing, when I see somebody who's, let's say, normally I don't get to see anybody until they're maybe months, even years down the line after their mild head injury,
Mm-hmm.
where they've still got post-concussion symptoms. Usually they're still very severe post-concussion symptoms. So even though they've been told this head injury is mild, inverted commas, their
Uh-huh.
experience is not mild at all. And one of the first things I usually talk to them about is that although it's described as a mild head injury, that does not mean that what you're experiencing is mild at all. I mean,
Mm.
if you're not back at work after a year, your concentration is still awful. You're getting dizzy every time you're walking around. You have headaches most of the day. Your
Mm.
short-term memory is not very good. that's not mild.
Mm-hmm.
That's not a mild experience. So that's the first thing I want to do, is just to establish that although we're talking about a mild head injury, this does not mean what you're experiencing is a mild set of experiences. And the first thing I want to do when I meet somebody who's had a mild head injury is not just ascertain what kinds of post-concussion symptoms they have, but also what possible other factors over time since their injury might now be at least partially encroaching on the symptom picture. So inevitably some things must happen. I mean, if I had post-concussion symptoms for even 4 weeks, I would be getting worried. Even knowing a bit about post-concussion, I would be concerned. I'm not
Yeah.
back at work. This should
Yeah.
have been finished within a week or two, maybe 3 weeks. Go to the GP. Oh, well, you'll be fine, but I'm not. So I would be getting concerned. So there would be a degree of anxiety that
Uh-huh.
would already be creeping in from me even after 4 weeks. And that anxiety, even without any head injury, will cause me to have potentially poor
Mm-hmm.
concentration,
Mm-hmm.
short-term memory difficulties, sleep disturbance, fatigue, and
Mm-hmm.
now already be contributing to my symptoms. And so it's already not straightforward how much of what I'm experiencing is this subtle brain injury and how much is some of these other symptoms that have started to kind of bubble up, as it were. And the
Yeah.
longer that period goes on, inevitably, the more likely are to
Mm-hmm.
be some of these factors that have built up.
Uh-huh.
So one of the first things I'm interested in doing when I'm seeing somebody with persisting post-concussion symptoms is just to get a really comprehensive idea of what they're experiencing, how it's impacting their life, but what of these other factors might have been building up. Uh, then what I do is when I next see them, I kind of have a bit of a box diagram, lots of little boxes about, well, you're not sleeping so well. So that's a box because we've got poorer sleep. There is some stress. How could there not be some stress because of all that you've experienced and how it's making your life much, much worse? There's maybe an element of post-traumatic stress or post-traumatic stress disorder because lots of mild head injuries occur in situations which are very threatening, life-threatening,
Mm.
assaults, road traffic accidents. People perceive that they may have been about to die. So there may be
Mm-hmm.
post-traumatic stress, there may be pain, there may be other things. So a whole load of boxes, as it were, that make up a little diagram to say, well, okay, here's your mild head injury, here's your post-concussion symptoms, but here's lots of other factors that maybe have also built up
Mm-hmm.
over time, and look at the way that they might interact.
Mm-hmm.
And we get to a point, hopefully, where we say, yeah, that we've probably got something that looks like that might make some sense in terms of my experience after
Mm-hmm.
my mild head injury. And once we've got to a point where me and the person kind of say, yeah, okay, we think that looks like a pretty good game plan. We then can say, well, okay, which of these boxes should we first look at to see if we can try to reverse some of these vicious cycles that have got set up from these factors?
Mm-hmm.
And that's really where cognitive behavioral therapy sometimes will kick in, because we may use cognitive behavioral techniques to look at almost any of those boxes.
Mm-hmm.
So
Mm-hmm.
clearly, if there's some post-traumatic stress disorder, cognitive behavioral therapy looking at that post-traumatic stress may be the first port of call,
Mm-hmm.
because you may get some very significant
Mm-hmm.
improvements from helping the post-traumatic stress disorder part of
Mm-hmm.
things. And for some people that I will see, we will conclude that actually it's probably likely that the mild head injury itself, at least for some people, is no longer the thing that's causing their problems.
Mm.
That actually the problems are the same, but actually it looks like it probably could be all accounted for because of the post-traumatic stress disorder.
Yeah.
So let's treat the post-traumatic stress disorder and see what we have left. And then we can kind of have another look to see, well, is there still a bit from the subtle brain injury or not?
Yeah.
So that would be an extreme example where maybe all of the symptoms might be attributable to something else.
Right.
For lots of people that I see, there'll be some other factors as well as the subtle brain injury.
Mm-hmm. So the psychological factors like anxiety and depression, and then also kind of, changes to one's lifestyle. Maybe you can't go back to work in the
Yep.
same way you did, and
Yeah.
how does that impact your identity and self-esteem and things like that? So that's then stressful, and that can impact on sleep and fatigue, etc. So kind of looking at all the ramifications that the kind of mild head injury has had on someone's life, and then
Absolutely.
also their mental health. And are you saying that kind of then the sort of mental health picture might sometimes look like those post-concussion symptoms?
Yes, absolutely. Yeah. So almost all mental health conditions All pain conditions, all chronic fatigue conditions can look like
Mhm.
have elements that look like post-concussion
Yeah.
symptoms. Yeah.
And just to kind of illustrate the difference between, I guess, what a sort of mild head injury looks like for this very small
Mm,
subset of clients that you see 6 months down the line, 1 year down the line, who still have these persistent symptoms, versus someone who's had a moderate to severe
mm.
injury 6 months to 1 year down the line. What does that look like in terms of how patients might be recovering?
Sometimes it looks no, they look identical. So
Mm-hmm.
the kinds of things that somebody report after a mild head injury, if they have persisting post-concussion symptoms, can be very, very similar to what somebody is reporting after a severe head injury. My short-term memory is really, really not very good. My
Mm.
concentration is really, really poor. I am very, very irritable. I don't cope with stress at all well. I don't cope with change at all
Mm.
well. Whole range of things can exactly the same kinds of problems. The trickiness always is that you're more likely, if you have a severe head injury, that the brain injury itself will very easily be able to account for all of those
Mm,
symptoms.
mhm, mhm.
There may be other things that have built up as alongside that, other psychological things. With a mild head injury, that
Ah,
judgment call is much more nuanced and not as straightforward,
gotcha.
because the subtleness of the brain injury after a mild traumatic brain injury is for some people, they would say, well, it's not enough to have substantial brain injury symptoms. So there will be people out there that would say, actually, if you have a mild head injury and you are now 6 months or a year down the line and you're still experiencing what look like post-concussion symptoms, they're not. They're nothing to do with the mild brain injury.
Mm,
They're to do with all these other factors. And
mhm.
they'll be emphatic and they'll say, that's it. It's a functional disorder, in inverted commas. It's purely psychological if these symptoms have persisted. And in the early days, when I was researching and involved in mild head injury, that was a very common way of thinking about mild head injury.
Mm,
Very, very common. Commonly, people would say, well, actually, it must be psychological because the brain injury is too subtle.
mm.
And even more recently, when we've had more sophisticated techniques to look at the brain in very much detail, things like diffuse um, DTI, diffuse tensor imaging,
Mm.
um, you can show some very subtle brain injury changes for some people with mild head injury who have persisting
Wow.
post-concussion symptoms. But some people would still say, yeah, but that's insufficient to cause this multitude of disability that is now this person. So even if we can show something, that there is something subtle going on in the brain, that's not necessarily enough for some people in the field to say, oh, but that definitely says it's a brain injury that's causing the
Yeah.
problems. And also you can get these DTI changes, these subtle brain changes for things that haven't involved a head injury. So with depression,
Ah,
you can get
okay.
DTI changes. So again, some people would say, oh, well, look, it's nothing to do with the brain injury, the DTI. So they would say two things. The DTI is not anything to do with the brain injury, maybe, and B, that even if it is due to the brain injury, it's just too subtle to explain this severity of
Mm.
symptoms. So there's always a position where at least some people will be quite skeptical about the extent to which subtle brain injury maybe is causing
Yeah.
these longer term symptoms.
So the organic change to the brain doesn't seem to be, in some people's minds, significant enough to account for these post-concussion
Yeah,
symptoms.
the subtle brain injury is too subtle to account for
Yeah.
any symptoms
Yeah.
beyond 6 months, would be some people's position. It's not my position. And that perception has changed
Mm.
um, much in the last 10, 5 to 10 years with the era of sports related
Yeah.
concussion, which is kind of, for me, it's changed the landscape of mild traumatic brain injury and concussion in quite a significant way. Um, Pushing that idea about, well, it's all psychological if there's persisting problems,
Mhm.
almost to the other way
Mhm.
because of, well, we may come on to it, what's
Mhm.
happened in sports related concussion.
Yeah, so I'm curious about that. I've written down, I want to know about the history of this. But I wondered actually if you could just take us back to when you first started working in this field and what got you interested in it, and kind of how you got into sort of mild head injury,
Mm,
and then how the landscape has changed
mm.
since
Yeah,
sports
yeah.
related concussion.
Well, it was entirely by accident. I remember doing an essay, a literature review on mild head injury when I was a trainee clinical psychologist.
How
And I
many
remember
years ago was that?
it was 1992. So yeah, so quite a long time ago now.
I wasn't
It was a handwritten. You probably don't. It was a handwritten literature review. That's how long ago it was.
it wasn't a lot.
There you go. So I wrote this. I did this literature review in 1990 or 1992, whenever it was.
Okay.
Well, I was a training clinical psychologist all those years ago. Thank you for reminding me of that. And I remember writing it and thinking, this is so complicated. I just wanted something, as a trainer, I wanted something very straightforward from a brain injury point of view, a brain point of view, neuropsychology. I want it simpler. And I remember thinking, well, it's not going to be for me, this mild head injury area. But then lo and behold, my very first job, half of my job was involved in a randomized control trial research project looking at early intervention after mild head injury. So following people up within the first week of their mild head injury, giving them a random half of our sample, some therapy and some information and those kinds of things, and seeing whether that helped post-concussion symptoms a bit later on, 6 months down the line. So I was kind of thrust into mild head injury purely by accident, hadn't chosen this at all. My literature review and essay had put me off completely. And
Of
yet here
course,
I was.
handwritten.
Handwritten,
Awful.
exactly. Yeah, I know, it's terrible. It's barely imaginable. Um, so yeah, so I found myself thrust into that area. And that's what got me interested. And so I had 5 years on that project. And I was very, very lucky in a way because once I got to this randomized control trial, Professor Derek Wade had already compiled a question, something called the Rivermead Post-Concussion Symptoms
I know
Questionnaire.
it well.
He compiled it. I turned up, and there was no other measure of post-concussion symptoms at that time. And so we kind of decided that we ought to do, at the very least, we ought to do a reliability study on it to make sure that if you administer it 2 times, you get the same kind of result. So at least needs to look at its validity as a questionnaire. We can't just make up a questionnaire and think it's going to be valid. So I did that, straight out of training. We published it, and that's now probably the widest used measure of post-concussion symptoms there is. And I get all the I'm first named author, and when I saw Professor Wade fairly recently, I had to thank him profusely for the fact that I just people think that I compiled it. I didn't. I just happened to stumble in, and there you go. So that was my kind of
Your journey.
starting point in doing some publications in post-concussion symptoms. Yeah.
And can you name any of those just for listeners on what might be on there?
On the post-concussion
Yeah.
symptoms. Yeah, so in this 16 of the most common post-concussion symptoms, and gets you to rate whether there's never been a problem to you, it used to be a problem, but it's no more of a problem, or whether it's a mild, moderate, or severe problem over the past week. And that will be like headaches, dizziness, poor concentration, taking longer to think, low mood, anxiety, sensitivity to light or noise, headaches, those kinds of things. So 16 of the most common post-concussion symptoms.
And did I read correctly in your paper with Alice Coates? I think I wrote it down. That this very small minority of people develops these symptoms over several months, and I think it was 1.5%. Is that right, or
Well,
is that, do you know?
the numbers differ quite widely depending on what study you look at. But if you were to say, okay, what proportion of people, let's say at 12 months, might still have some symptoms, whether that's purely from the subtle brain injury, a combination of the subtle brain injury and these other factors, or possibly even maybe other factors full stop, but who might present still with kind of some significant symptoms, maybe at 12 months and beyond. I think the best kind of numbers are around the kind of 1 to 5%.
Okay.
That kind of number.
Yeah.
You see numbers up to 15, sometimes 20%, depending on
Yeah.
the cohort of people that are looked at. But there's so many people getting mild head injuries. The lifetime probability is 2 to 10%. So lots and lots and lots and lots of people are getting mild head injuries. but I don't see the vast number
Mm,
that would have persisting post-concussion symptoms if it was a figure more than 1 or 5%. I
yeah,
don't think, and so I tend to work on that basis that it's that kind of
yeah,
ballpark figure
yeah,
that we might be talking about. That of people that might not go on and have a kind of a full recovery quite quickly
yeah.
in the first few months or so.
And do you know why that is, that there's more people getting concussions these days? Is that sort of sports related? Is that, I mean,
Yeah,
what do
I
you put
don't.
that down to?
Yeah, I don't know whether more people are getting concussions, um, but people are much more alert and aware
Ah,
of concussion,
okay. Mm-hmm.
massively more so. And the very real thing with a concussion, mild head injury, that one has to be very wary of is there is a small group of people, not talking about long-term post-concussion symptoms now. There's a small group of people who will have what looks like a mild head injury, but will have actually caused a bleed in the brain that
Mm-hmm.
is actually a very serious brain injury, but it won't necessarily be obvious right away. So that's the reason why people go off to A&E to be assessed.
Mm-hmm.
The most important reason is that they get checked out, that they haven't got some subtle brain injury, subtle bleed that's causing a much more significant
Yeah.
brain injury,
Yeah.
that may not be aware. So yes, you can
Gotcha.
say, oh, this looks like a mild head injury. Yes, they're probably going to be fine. However, they might be one of this small percentage of people. And you see, the boxers that got, there was a boxer, I think only 2 or 3 weeks ago, a Japanese boxer that died in the ring. And
Mm.
it's likely, I don't know the circumstances, but often when tragic situations happen like that, what looks like a mild head injury, i.e., you've been knocked out, which is in boxing, that's what you're attempting to do.
Yeah.
Actually, it's not a mild head injury, it's a mild head injury plus it's caused a bleed. And it's
Uh-huh.
that bleed in the brain that needs to be assessed and intervened very quickly with
Right.
if you're one of those very unlucky people. It's a very small percentage,
Yeah.
but nonetheless, that's the really crucial medical assessment that's important after a mild head injury.
Okay.
So in a way, mild head injury used to be there were just two things that you were most interested in. One, very immediately, medically, is this just a mild head injury that hasn't caused a bleed? Majority would be in that situation, but we
Mm-hmm.
need to check it out because if it's
Mm-hmm.
not, something quite significant needs to happen medically very
Yeah.
quickly. And then the other, on the other hand, is this somebody that may end up with persisting or long-term post-concussion symptoms?
Yeah.
They were the two kind of, and then thirdly, well, what do you do and help somebody in that
Mm-hmm.
situation if they have persisting? They're the kind of, I said there's two, there's three. So I would say they're the three kind of major
Yeah.
themes within the mild head injury research and literature up until fairly recently when the sports related concussion area became
Uh-huh.
much more prevalent. And then a
Yeah.
kind of a third area has emerged, that still being a very important part of sports related concussion, those three things. But then there's been a fourth thing that's also emerged that most people then hear about most of the time, which is if you have multiple mild head injuries, multiple concussions, is there a chance that increases my chances of having some degenerative disorder later on in life, like
Mm-hmm.
chronic traumatic encephalopathy,
Mm-hmm.
CTE,
Mm-hmm.
or Alzheimer's or some other form of dementia?
Yeah.
And that's an additional change to a big change to the landscape in what people are now very interested in, for obvious reasons.
Yeah.
And that's kind of the big shift, and that's happened probably since 2005 when
Mm-hmm.
there was a pathologist called Amalu who did a brain biopsy on an NFL American footballer and found that he had chronic traumatic encephalopathy, and it was attributed to all the concussions that he had had as an
Uh-huh.
NFL footballer. And then from that moment on, that this potential increase in probability of having something later on in your life develop because of
Yeah.
multiple mild head injuries. These are people with multiple concussions rather than
Mm-hmm.
just a single one, that has become a big
A
focus
big focus. Yeah.
and has changed the landscape, I think, in terms of how probably the public see mild head injury.
Yeah. So before we go on to think about mild head injury versus sports related concussion, of which you have written two papers. So let's talk about that. But just before that, I just want to ask you, so if someone in the UK is struggling with persistent post concussion symptoms, 6 months, 12 months on from their concussion. What would you recommend for them in terms of seeking support? Do you feel that, generally speaking, the NHS kind of serves this population well? Do you think there are other resources that people can use? What would be your recommendation?
Yeah, so I think in terms of the NHS, I have to say it's patchy in
Mm-hmm.
terms of the degree to which there's easy, accessible help for somebody who's had a mild head injury and persisting post-concussion symptoms. There will be neurorehabilitation services in most areas of the country that the NHS provides. The trickiness is that some of those neurorehab centres may not see people with mild head injury.
Yeah.
They may say, actually, our cut-off for seeing people is people only with severe brain injury. And so by definition, one is excluded from those. And then quite possibly, from an NHS provision point of view, it might be very, very difficult to access somebody that may have
Yeah.
some expertise in understanding what's going on and helping the person
Mm-hmm.
with, say, persisting post-concussion symptoms. So if there isn't an NHS provision neurorehabilitation centre close to somebody that offers help with persistent post-concussion symptoms, the next port of call is probably to think, well, can I access somebody privately outside of the
Mm-hmm.
NHS?
Mm-hmm.
And normally I would kind of recommend people to try and find somebody who's a clinical neuropsychologist or a clinical psychologist experienced in neuropsychology, because they're probably the people that are going to have the most experience or understanding of long-term post-concussion symptoms. They're not
Mm-hmm.
the only people. There may be neuropsychiatrists or other professional groups as well, but I am a clinical neuropsychologist, so
Mm-hmm.
that's kind of where I would tend to point people. If
Yeah.
there isn't NHS provision, I would say,
Mm-hmm.
well, I would try and find a private clinical neuropsychologist or a clinical psychologist in neuropsychology, with some experience of mild head injury, and they
Yeah.
should be able to start to be able to have
Mm-hmm.
these conversations about how we can best help.
Okay, cool. Thank you. And yeah, I would echo that. In my experience working in London, I think most uh, clinical neuro rehab services offer support for the 12 months following, um, yeah, a more serious injury. I haven't worked in a team yet where there's been much support for
Mm.
post-concussion symptoms. But also, there's Nigel has some books on overcoming post-concussion symptoms, so I'll link that for anyone who wants to read
That's a
more
very good
about that.
read.
Yeah.
As you know.
As I know, I've got 2 copies at home.
Yeah.
Okay, so back to the landscape of sports-related concussion and mild head
Yeah.
injury. Um, as I understand it, these are 2 subtly different things. They're defined a little bit differently in the literature. Is that right?
Well, in a way, they're not this. They should never be any different. A
Mm.
concussion, a mild traumatic brain injury, a mild head injury is a mild head injury, and whether you
Mhm.
get it from a road traffic accident, being assaulted, or playing a sport, it is the same thing.
Mhm.
But there is a subtle difference, I think, in terms of how those things are approached in the literature,
Okay.
and yeah, and we can talk about some of those subtleties and also about some of the different emphasis
Yeah.
that happen in the research literature with sports related concussion versus more broadly mild traumatic brain injury and concussion that's not necessarily just from a sports injury.
Uh-huh. Yeah, that would be really
Mhm.
interesting to hear about. There's actually a table in one of your papers where you
That's right. I'm
kind of
trying to imagine it in
specifically,
my head now
but I didn't
while
want
you
to
ask me the
bring
question.
my laptop because I know that this is an analog
Right.
setup for you today, so I don't have the yeah, I don't have the paper with me. But yeah, what would you say the kind of emphasis is on more for the sports related
Mm.
concussion? That seems to be, yeah,
So the
unique there.
sports-related concussion, there are a number of key, very, very clear and questions that need to be asked. Similarly to any mild traumatic brain injury, this person, if they've had a concussion, they need to be assessed in case they're one of these small minority of people where it's actually a bleed that's going on, and so on. And that's, so the same thing as any mild traumatic brain injury. We need to exclude that. The second thing is, well, when should this person be allowed to play again? So
Mm.
return to play is a very big emphasis in the sports-related concussion
Mhm.
field.
Mhm.
So, this person says, I'm fine after 2 days after a mild head injury. Well, can they go back and play rugby,
Mm.
American football, whatever, when they risk getting another mild head injury? And if you've had a mild head injury and you've still got some persisting problems, you're more likely to get another mild head injury because your reaction time is going to be slightly slower. So there is some evidence that, if you're a rugby player, an American footballer, and you do return to playing those sports before you are fully recovered, you're more likely to get a second one, and then you've got a potentially an additive effect of having one on top of the other, as it were.
Because your reaction time is
Yeah, your reaction
slower.
time is slower. Your concentration's not as good on the pitch, and so
Right.
before you know it, you've collided with somebody else, and you've got another mild head injury.
Ah,
Um,
so
and
that's really interesting. Sorry to
mm,
interrupt. So I guess what you were talking about before, which is this kind of cumulative effect of
mm,
having multiple injuries and then potentially the impact on your brain as you age and cognitive decline. So I was sort of thinking just about the cumulative effect, and yeah, that's just really helpful to think about actually the more immediate effect of returning to
mm,
play after you've just had a concussion, and
mm,
your speed of information processing, your reaction time, and all of that, then increasing your likelihood of having a subsequent
mm.
injury. Maybe that's really obvious, but to
Well,
me, that seems like
the
a
thing is that
really important
not
thing.
everybody is 100% aware that this is going on. So you may return feeling, I think I'm pretty all right. I think I'm all right. But actually, if you test the person's reactions, they are a bit slower than they would have been
Uh,
before. I feel all right, but actually, if you do some tests, actually their concentration is not quite as sharp as it was before.
right.
And particularly for people who are very, very competitive, people that are used to kind of pushing through the pain barrier, kind of denying that there's any problems. I'll just push on through.
Yeah.
Particularly if you're that kind of person, well, you may not really be completely aware that there is some changes.
Mhm.
The other tricky thing is that even if you are absolutely 100% better from your post-concussion symptoms, what we do now know is that actually the metabolic processes in the brain may still be recovering even while you are 100% better.
Mm.
So there's some quite nice studies that suggest that actually that metabolic um, it, recovery in the brain for some people can be slower than their symptomatic recovery.
Ah.
So there is the potential that you feel 100% better, but actually your brain is still realigning itself. The neurotransmitters that have been
Mm.
disrupted, the subtle brain injury that has occurred is still healing itself, even though you haven't got any symptoms.
Yeah.
So there's a number of little factors that one has to kind of think about in terms of somebody returning to play after a sports-related concussion. But it would be no different probably to somebody in the military that maybe looks like they're getting lots of concussions because they're in war situations. Should they go
Mm.
back to the front line?
Mm.
Would be a similar kind of question because we're going into a situation where a mild traumatic brain injury, a concussion, is more likely than for somebody not in that context.
Yeah.
If I go back to work, I've got a very low probability of getting a mild head injury while I'm
Mhm.
working. If I'm
Mhm.
a professional rugby player, if I'm in the military and going to the front line, well, I've got a much higher probability. So
Yeah.
that's where that question becomes
Ah,
much more pertinent in sports-related concussion
yeah.
fields, and also a duty of care from the associations that are involved in those sporting
Yeah.
arenas. They have a duty of care to make sure that the advice that people get is the best possible advice medically.
Yeah.
And that's part of what's happened since the Amalu case and the American Football Association, the NFL Association has kind of had to make sweeping changes, lawsuits, all of that kind of
Mhm.
stuff. People have become, have had to become even tighter
Yeah.
in terms of saying, well, actually, this is when you can return to sport and this is not when you can return to
Yeah.
sport.
So on paper, a mild head injury and a sports-related concussion are sort of
They're
the
the same.
same,
They're a
but
concussion. They're a concussion.
they're
They're
a
a mild head
concussion,
injury. It's just in a different
different
context,
context.
and
Yeah.
there's now more. And there's immediate things that are now more obvious in a sports-related concussion, i.e., well, when can this person return back
Mhm.
to
Mhm.
to sport? And also, if this person's getting lots of concussions, is there a chance that they're going to be getting something later on in life? Is it going to be
Mm.
increasing their chances of getting some form of
CTE.
dementia, CTE,
Yeah.
that kind of thing
Yeah.
later on? And
Yeah.
that's an unsettled picture in terms of the likelihood of that happening.
Yeah.
My reading of the literature is that if you're a professional sportsman,
Mm-hmm.
in those situations where you may be getting lots and lots and lots of mild traumatic brain injuries, concussions, then the evidence so far does look like it does
Mm-hmm.
increase your
You're right.
chances
Yeah.
of having something later on in life. The difficulty is that most of the studies that have been done aren't massively high quality. And the other difficulty interpreting the data is that very few of those studies that I've seen allow for other factors that you can have during your life that increase your chances of later life dementia. So
Mm.
things like obesity, things like smoking, things
Mm-hmm.
like poor sleep, post-traumatic stress, depression,
Mm-hmm.
all of those things increase your chance of having dementia later on in life.
So they're
So
not controlling for that stuff very well.
that's my reading,
Yeah.
is that that's the trickiness in the literature,
Yeah.
is that you can show here's a population of NFL American footballers that, yes, if you look at the proportion of those people at the same age later on in their life, there is a greater proportion of those with dementia or CT or whatever,
Compared to the general
compared to the
population.
general
Yeah.
public of the same age.
Uh-huh.
So almost all of those studies control for age, which obviously you have to,
Mm-hmm.
um,
Mm-hmm.
but very few of them control. Well, I haven't seen any that have controlled for all of those 5 or 6 things that I've just described.
Those lifestyle
No,
factors. Yeah.
some control for some of those, but I haven't seen any as yet that have controlled for all of them.
Mm.
So the actual research is more unsettled than I think is usually presented. I think when I see it's presented in everyday life. Well, I'll tell
Yeah.
you, and I'll tell you another football story just to give you an example of this. So this is soccer again for your North American
You and your brother
viewers.
playing
No,
or
it's not my
no?
brother playing this time. And this is only a couple of years ago, and this shows you the difference. So when my brother played, nobody would have, yeah, the sports related concussion thing hadn't happened at that point. We knew that a head injury you need to look at, but there
Mm.
was no kind of get him off the field. It was, yeah, okay, we'll get him off the field and we'll do something. So this 2 years ago, let's say, something like that. I'm watching my local football team play, and I'm just watching it. I tend not to want to talk to anybody. But there happens to be a guy next to me, and he starts talking to me about the game, and I'm being polite and just saying, "Yeah, it's a good game." And then he says, "The ball goes up, really high ball from a goal kick, and the defender heads it, good firm header." And he says, "Oh, yeah, my cousin's got dementia from heading a football." So this is
Interesting.
somebody. So
So
this is
it's in the
somebody that
discourse.
in the discourse. This is somebody
Yeah.
that's just picked up in from TV, podcast, newspaper, that hitting your head, mild head injury equals later life
Mm.
dementia,
Mm.
or
Mm.
later life CT or something like that. And
Mm.
for him, he'd obviously heard that there's some of these studies that show that football players, soccer players, have professional soccer players. There are at least 1 or 2 studies that show that the proportion of those is higher with dementia later on in life.
Mm-hmm.
And what he has then picked up and how that's been portrayed publicly
Right.
is that football, full stop, out not professional, just heading a football must be the thing that
Equals.
caused you
Yeah.
that thing later on in life. So this guy, you know, I'm pretty sure he wasn't a researcher in the field. He was just a guy watching football, and what
Mm.
he'd picked up is, oh yeah, my cousin's got dementia because of heading a football.
Wow.
So,
Wow.
and that's the change in the landscape,
Yeah.
in terms of perception. So for me, the pendulum has swung from here's a mild head injury. The actual brain injury itself is maybe for some people, it's not significant, and you won't have any symptoms. And if you do, they're psychological. So that's the pendulum
Right.
30 years ago
Wow.
when I'm writing my essay
Mm-hmm.
in freehand without a computer and all those things, to now
Mm.
it's there is a potential perception that it's the other end of the spectrum, that a mild traumatic
Right.
brain injury, a concussion, is something. Obviously, yes, it's important to assess very early on because it might be a bleed.
Mm-hmm.
But now, for some people, the idea of concussion is that this is a very, very, very severe thing and will cause you this thing later on in life, come what may.
Yeah.
Even if you're not a professional player, even though those numbers are maybe not that dissimilar at times to these other factors that might cause
Mm-hmm.
later life difficulties,
Mm.
that has now become the kind of, I think, the more public
Ah,
perception of what a concussion is. And that in
wow.
itself, that public perception,
Mm-hmm.
then can cause things to be more complicated clinically, as
Yes.
you probably read in my other paper that I sent you to. It was a kind of clinical
Yeah.
example of how this perception of brain injury or of mild traumatic brain injury can actually be part of the problem rather
Yeah.
than part of the solution when you have persisting post-concussion symptoms.
Because of the narratives around what people think they should be experiencing, or because of anxiety then contributing to difficulties with concentration, attention, memory, and that kind of thing,
Yeah,
you
so
mean?
it's the anxiety that I've had this mild head injury, but the mild head injury is something that makes my brain very, very vulnerable.
Uh-huh.
And it's so vulnerable that if I have another one, then I'm gonna get dementia later on in my life.
Yeah.
So the perception of what that mild head injury is may be
Feels
much
more
more significant and
catastrophic.
catastrophic
Yeah.
than it might otherwise be if you don't know the landscape of the literature.
Mm.
If your main understanding of a concussion is that this is a very significant, I've still got post-concussion symptoms, and now I'm going to get later life dementia. What that will mean is my brain is ultra vulnerable now to another hit, tap, concussion, or whatever.
Mm-hmm.
That causes me loads of anxiety. It means I can't get back to exercise.
Mm-hmm.
It means, therefore, that those things in and of themselves may contribute to post-concussion type
Uh-huh.
symptoms and be part of the problem rather than part of the solution.
Yeah.
So
Yeah.
that change in perception of how what a mild head injury means does have some clinical implications, at least at times. And we wrote of a
Yeah.
case study where that was at least partially what we were helping the person with
Mm-hmm.
in terms of the cognitive
Mm-hmm.
behavioral therapy was what the meaning of the mild head injury was.
Yeah.
So
Yeah.
for this person, it was a rugby player with persisting post-concussion symptoms. At least part of what was going on was an anxiety around what that meant in terms of
Yeah.
later life CTE, later life
Mm-hmm.
dementia,
Mm-hmm.
just a single mild head injury, not a
A
professional
single
rugby
one.
player. So it's not
Yeah.
not in the category that we've got any evidence, but very strong evidence at least at all, that if you're not outside a professional realm, that will be the case. But for
Mm-hmm.
him, I'm a rugby player. I've had a mild head injury. I'm now probably going to be facing later life dementia as a result of that. And I've still got persisting post concussion symptoms. So that means that my brain must be really, really vulnerable
Gotcha.
should I get hit again.
Mm-hmm.
Yeah.
And your formulation was that, yeah, there were cognitions that were sort of getting
Yeah.
in the way of his
Yeah.
recovery,
So
or,
if you have a
yeah.
cognition that my brain is very, very badly damaged to the extent that I'm now going to get I'm going to get CT later on in my life. I've got post-concussion symptoms and I'm being told that I'm not allowed to go back to playing sport or rugby or exercise until
Mm-hmm.
those symptoms have got better, and they're not. Well, that kind of, how could you not have a perception that my brain is in a vulnerable position right now?
Mm.
And if it's in a vulnerable position, well, that would cause me a lot of anxiety. It
Mm-hmm.
would mean that I'm not exercising, which may be the way in which I kind of gain some stress relief through sport, sense of identity, because I'm
Mm-hmm.
such a good sportsman, as you know,
Mm-hmm.
in many areas. So my identity is affected,
Mm-hmm.
my stress coping is affected, amongst other things, and I'm feeling that if I get another blow to my head, that could be really, really serious.
Mm-hmm. Mm-hmm.
Well, that's a very different illness perception
Yeah.
than what my brother would have had
Yeah.
20 years ago
Yeah.
when he had the clash of heads.
Okay. That's so interesting about how that's percolated down.
Mm.
Yeah. I guess one other thing that I was reading is just now frequent neuroimaging is being recommended for professional players. So that's kind of something else I thought was interesting
Yeah.
um, in this field. But that makes sense in terms of this professional group.
Yeah, if you've got a
Yeah.
professional group where there's a higher likelihood of you getting another mild traumatic brain injury, kind of discerning actually, is there something from a subtle brain injury point of view that's going on for this person with persisting post-concussion symptoms or
Mm-hmm.
not? That is clearly, from a kind of duty of care point of view, a really, really important question to answer.
Mm-hmm.
So I'm not surprised that more and more professional athletes are in a context where brain imaging, multiple brain imaging is part of that return to
Yeah.
sport protocol.
Sport, yeah.
I mean, if particularly if you're thinking about in a boxing circumstance, you are going back into arena where the whole purpose is to inflict a concussion.
Yes,
Yeah,
yeah. My
that's
goodness.
the reason you're in the ring,
Yeah.
is trying to inflict a concussion on somebody else. So that's probably the extreme end of the combat sports, and boxing is at the extreme end of probability of getting another
Yeah.
mild head injury,
Yeah.
right through to sports where,
Uh-huh.
well, there was very little chance at all.
And question for you, sports person. Now, knowing what you know about head injury, if you were to rewind the clock
Mm.
back 20 years, would you take up boxing?
Would I take up boxing?
Yeah.
Um, I don't think I'd take it up professionally.
Okay.
That's that's something I probably wouldn't do.
Okay.
I'd quite, I mean, there's parts of me that would quite like to have had a round or two boxing just to see what it's like.
Uh-huh.
Um, but certainly I wouldn't be taking it up professionally in
Okay.
terms of,
Do you think that's related to what you now know about
I don't know.
post-concussions and
It
stuff?
probably is to some extent. I probably
Yeah.
wouldn't want to get hurt as much as
Mm.
people do in boxing.
Mm.
I suspect the first time I actually did box and got punched right in the nose very, very hard, I'd probably think this is not for me. I
Uh-huh.
suspect that would probably be
Okay.
a very motivating force.
Mm.
But no, knowing what I now know about about boxing and other sports that have a very high probability of having lots and lots of mild head injuries,
Yeah.
I certainly, that would be something that I would be very much bearing in mind in
Yeah.
terms of, I would need to factor that in to
Yeah.
my decision about, do I want to be involved? Do I want to commit myself to professional boxing?
Mhm. Mhm.
Certainly that would be part of the risk reward
Yeah.
um, thought process that I would have to think through.
Yeah.
Is okay, here's a context where I am going to be putting myself deliberately in a context where concussions, mild head injuries, are likely to be occurring on multiple occasions. um, Here is the evidence that I have about the increased probability that might cause in terms of having later life dementia. Um, these are the things that boxing will give me as a profession,
Mhm.
and in terms of all the things that I will have. Um, well, okay, I'm willing to take that risk, or I'm not willing to take that
Yeah.
extra risk.
Yeah.
And so it would be a tricky judgment call for me to make. But that would be essentially what I would want to do. I'd want to say, well, here's the relative probability of increasing my chance of having something later on in life that I'm going to have to deal with. Here's the other things that would contribute to that.
Mhm.
Here's the fact that actually, if I'm a professional sports person, I'll probably have an increased mortality rate. I will live longer because I'm fitter. So
Mhm.
that's a positive part of being an athlete and a professional athlete and all those kinds of things. So
Mhm.
I have probably on average a longer life because I'm going to be an athlete all my life, or a professional athlete for a period of time. And I'd make my judgment call
Mm.
on those
Mm.
kind of terms.
And the joy that it may bring if
It's
that's
joy
your
that the
passion and your
exactly,
skill set. Yeah.
exactly.
Mhm.
So yeah, there's a whole load of things that I'd have to be thinking
Mhm.
about. Yeah,
Mhm.
yeah. So I couldn't say for sure, but I suspect I wouldn't go into professional boxing.
Yeah. Yeah. Yeah.
I think that, and some of the ones, those areas where you get lots and lots of concussions, and indeed you get blows to the head that aren't pure concussion like a mild traumatic brain injury, but are what now is called subconcussive
Mm.
blows, which people are investigating to say, well, if you get lots and lots of those subconcussive blows over the course of your life, is that also going to cause you to have later life dementia? And
Mm.
that's the assumed cause for soccer players, to because most soccer players don't have lots and lots, as far as I know, of actual mild traumatic brain injuries over the course of their playing career. But if you're an outfield player and you're a professional footballer, you'll be heading that ball lots and
Mm.
lots and lots of
Mm.
times. So they're called subconcussive impacts. But the difficulty is, well, what's the lower reach of that? If I do that to my head, that's not a subconcussive impact, probably.
Yeah.
How hard does my head have to have an impact before it's subconcussive? If I hit a football,
Right.
it's not that much more than doing.
Mm-hmm.
that.
Mm-hmm.
Um, and so where do we draw the line of what
Yeah.
is a subconcussive impact? Is it is difficult to define,
Mm.
but certainly when you look at these studies and it's soccer players, football players that look like they're in a cohort that has an increased chance of dementia later on in life, that seems to be the main mechanism that people are thinking about. Is it these subconcussive blows from heading a football? The evidence we don't have that,
Yeah.
as far as I can see,
Yeah. How are we measuring it?
well, how do we measure
Yeah.
it? I don't, and even when we do measure it, I haven't seen any settled evidence to say that actually it's heading a foot. We can see a causal link between heading a football and that causing
Yeah.
cumulative subconcussive blows. But that's the assumed mechanism
Mm.
from these studies that show that here's a population of people, professional soccer players. Um, what else is there that could be?
Mm-hmm.
But that's
Mm-hmm.
yet to be proven. And
Mm-hmm.
my understanding of the literature is it's very difficult to show any immediate, obvious impact that happens when you have a subconcussive blow and you're heading a football.
Mm-hmm.
And that's
Mm-hmm.
different to having a mild head injury
Yes.
where actually you don't have post traumatic amnesia, you don't have a huge amount of changes in consciousness, but maybe a little.
Mm.
Um, but it's a continuum, and that's the tricky thing. There's a recent paper that's been published that looked at people who had persistent later life post-concussion symptoms going to a clinic, and did they have a mild head injury that involved some change of consciousness or some post-traumatic amnesia, or a Glasgow Coma Scale score slightly reduced, i.e. you're a little bit confused.
Mm.
So kind of what one could say, well, that is a mild traumatic brain injury, versus people that actually had a blow to the head that was significant and bad,
Mm.
but didn't have those things, that you might say, oh, is that a subconcussive blow? And
Mm.
actually, in terms of outcome, in terms of how they were doing, there was no difference between those two groups. So,
Interesting.
you're kind of this, where do you draw the line of what this impact to the brain is enough
Yeah.
is very tricky.
Yeah.
And so you've got a group of people that you would say, well, they had, and I think they termed it a minimal head injury,
Mm.
versus a mild traumatic brain injury versus subconcussive. You've got this,
Mm-hmm.
even within the mild spectrum, you've got this cascade of, well, here's a mild traumatic brain injury because this person did lose consciousness for a few seconds, had a post-traumatic amnesia of 2 hours, that, well, we can definitely say that was a mild traumatic brain injury. Here's somebody where they were a bit dazed and it was a very significant impact to their head. They had to go off, but they still remember it all, got loads and loads of post-concussion symptoms, and they seem to do no better than this other group if you've got post-concussion symptoms.
Yeah.
Well, is that a minimal brain injury? And then we've got subconcussive blows, which is heading a football where you don't get dazed at all, and nothing at all happens. Spent the whole game heading a football, and
Yeah.
I just go off and feeling fine, and
Yeah.
nothing happens. But if I did that enough, would that be
Yeah.
enough? So you've got this kind of
Mm.
range of, okay, where are we talking about something that is impactful, as it
Yeah.
were? And it may well be that as more and more studies are done, we find that certain people's brains are slightly differently, and so actually, we can find biomarkers, biological things that we can measure,
Yeah.
that tell us that this person is more likely to be susceptible to these kinds of impacts to the
Mm-hmm.
brain, and
Mm-hmm.
these people are less likely, and then you make a different judgment call at that point.
Thank you so much, Nigel, for talking to us today about mild head injury and sports related concussion. I feel like there's so much more we could talk about, but I'm aware we're three
We're out
minutes.
of time.
We're out of time
Out of
today.
time. Yeah.
But you're always welcome back
For part two.
for part two. Yeah, thank you so much.
Oh, you're very welcome. Very
Thank
welcome. And it
you.
just shows you where a handwritten essay can get you, doesn't it?
It does.
Yeah.
Wow.
Yeah.
Thank you, everyone, for listening to Wired for Hope today. I hope you enjoyed it. If you like this episode, you can like, subscribe, and or follow me on Instagram at Dr. Jess Neuropsych or at Wired for Hope Podcast. If you want to hear more about my personal reflections or the context for the interview, head over to where you get your audio-only podcasts, such as on Apple, and I'll share a little bit more about the context for the video and who the speakers are in those episodes. Please note that this is not a substitute for direct psychological advice or support, and you can check out the podcast notes for a list of services in the UK to support you with your mental health or after brain injury. All right, thanks everyone.